Jameson's Women's Center really lets us offer the total package for our patient. It lets us take care of them from screening, through diagnosis, through biopsies, through treatment, surgeries. It's the technology and the people working together to take care of the women in our community.
The Women's Center was a vision of Debbie Thompson, my supervisor, 5 years ago. And when she brought me into the Women's Center, no one in particular wanted to stay in Newcastle to have their biopsy done. Since we've started the Women's Center, the vast majority of our patients now stay and have their biopsy done with us. And so I feel that's a very important aspect, that we're keeping our people local. They don't have to go to Pittsburgh to have a biopsy done. They have confidence in us now that they can have it done with good results.
I see a team, and the team is so important. And it's the main focus of the team, and the only focus of the team is the patient care, as a patient self. And that's one of the great things I think that makes it so wonderful, because the team is close by. The team is all here together, that they can communicate together, they can plan together, they can work together. And the patient, like I said, is always at the center.
So digital mammography, which we do offer here at the Women Care Center in Jameson, is the latest mammography tool that helps us detect these breast cancers when they're very small. So we are very fortunate that we have the digital mammography technology here at Jameson.
And you really need not a scientist, but an artist to get that perfect, and maybe a lot of intuition too. So that is the thing that makes Dr. Gazinski probably the best in Western Pennsylvania. I know, I've been here long enough that I know almost all the areas that see a lot of breast cancer. And she's connected with Jameson and one other center.
First of all, my technologists are great at positioning the patient so that they optimize the tissue inclusion. Therefore, we're able to find these lesions. The other tools that we can use are ultrasound, because sometimes a patient may feel an area, a lump, something new, and that often can be found also with ultrasound. So together, they work together in conjunction. The digital mammogram is very good, but we know mammograms aren't perfect and they can miss certain lesions that we can't see. So ultrasound is then a supplemental tool that we often use to find additional lesions. And again, the smaller the lesion, the better the chance that we can get you cured and on your way to survivor.
Down at the Jameson South Campus, and I had my biopsy there. It was the best experience I've ever had for a biopsy. They treated me like a queen. I was never treated so good on biopsy. They talked to me, they acted like I was family, they kept me comfortable, got follow-up calls. I don't know what more I could say for them, because it was fantastic.
Dr. Gazinski's wonderful. She's very adamant about keeping her patients comfortable, not talking around them, but talking to them. They are your priority. I'm relaxed as much as we can, even through a biopsy. The outcome of that biopsy is going to be that that patient isn't going to have as much pain because we can relax her. We talk to the patients throughout the biopsies. We keep them occupied. And we've had so many patients tell us, are you finished? Are you serious? Are you done? They're that comfortable during the biopsy. After their biopsy, I call them the next day to see how they are. And then when the pathology comes back, then we talk about the pathology. So I do interact with them quite a bit.
No one knows how difficult it is, the diagnosis of cancer, until you have it. I mean, you cannot find enough words to explain and to express what the patient goes through. I mean, if you don't have the experience yourself and you went through the diagnosis of cancer yourself, it's very hard.
Talk about a wonderful surgeon. He's fantastic. That's my first time being with him, and he made me so comfortable when we come in and talk to him.
We don't ask the patient to worry about any of the medical and the health-related issues. We're just worried about their mental health. That's the most important part. So we would like the patient to have hope and to be confident that they're going to be fine and they're going to beat cancer. That's the most important part.
I think I said earlier, we're part of the team that treats breast cancer. And a lot of patients that get a mastectomy, a breast removed, don't need radiation. But when they don't have mastectomy and they have the lump removed, that we used to call it lumpectomy, almost all of those will get radiation as part of their treatment. So I really want to treat patients like family, you know, and somehow it just grew and grew. They may have been like that before I got here, but certainly they molded themselves to be more caring and to be more family-like to the patients. And when you see a patient every day, like most of our patients are coming in daily for several weeks, we really get to know them. It's not like an x-ray and then you go home and you see a person once. You develop a bond.
The most important part of the reconstruction is to restore the image of the patient, is to give her the hope back, give her the confidence, and give her the love of life. Just to know that she does not have to be remembered every time she go out, that she had cancer and she had lost her breast.
They know what you're going through. I mean, they've seen others too, so I mean, they make you feel comfortable.
She will not be limited, and that's a very important and major part.
I feel good about myself because I feel like myself again.
What is special about our center here, that it's the same team that provides all the service, and I'll be the surgeon who'll be performing the cancer procedure, and I'll be performing as well the reconstruction procedure.
I love the patients. I care about them. I worry about them, and I like to be a part of helping them to find things early.
For me, it is being able to help women and a few men through the journey of breast cancer. You know, and I tell them it's going to be a roller coaster. It's not going to be easy, but we're going to get you through it. And together, you know, me working with the rest of the team, the oncologists, the surgeons, will get you through this journey. And what's amazing to me is how strong women are as they go through the journey and often after the journey.
I feel honored that I'm able to provide this to our patients. I've been a nurse for 20 years, and I'm blessed that I have this job now.
Time and time again, the number one thing I hear back from patients who have gone through the experience here at the Women's Center is the people here made an unbearable situation wonderful. And I don't know how they do that. They do that because they care. They do that because they've had the training and the technology to make it happen. But it's the people and technology working together that really make those situations wonderful for our patients.
And once that whole wheel is completed, like I said, the patient is still always in the center of that wheel. And no matter which way they turn, they're going to see a part of the team that only cares about them and is here for them at all times.